Welcome back to What's Now. Right now we're going to talk about diabetic nerve pain. This can include tingling, numbness, and much more. Many people struggle with this condition. Here's more information.
The first question is for you. Can you tell us a little bit about diabetic peripheral neuropathy or diabetic nerve pain and its symptoms?
Absolutely. And first of all, thank you so much for having us during this Peripheral Neuropathy Awareness Week. It's so important. Diabetic neuropathy, it's one of the most common complications of diabetes, as it may affect up to 50% of patients with diabetes. And as we know, we are living a diabetes epidemic with more than 34 million of Americans living with this disease as we speak. Neuropathy is due to progressive damage and loss of these multiple nerve fibers and nerves that are very important, because once these nerves are being damaged, patients lose sensations and thus important daily functions. They lose balance, they have less ability of walking, they may fall, they have less ability of feeling even minor injuries, for instance in their feet, that can lead to ulcerations and then to amputations. And unfortunately, neuropathy remains the leading cause of non-traumatic amputations even today. In addition, patients experience symptoms, and particularly this neuropathic pain or nerve pain, which is like a shooting, burning pain that starts usually in their feet, both feet, and usually at night or when resting. But it can be extremely disabling because it can affect sleep, affects moods, induces anxiety, and then as progresses, it affects additional daily living function, including driving. And it is also very challenging to treat. It may require a combined therapeutic approach, and some of the medications that have been shown to be effective to reduce pain, in fact, have side effects that can further, close this vicious cycle and burden in our patient life.
Wow, thank you for that, Doctor. And Lindsay, can you tell us about the key findings from the survey?
Yeah, so recently there was a nationwide survey that was conducted by an external research marketing consultant, and those findings were reported to us at the Foundation for Peripheral Neuropathy. And many of the findings that were reported, we found to ring true with the patients that we speak to on a daily basis. One of which is the fear of the progression of their condition, and specifically the fear of the progression of their symptoms of pain. Many times you get diagnosed with a new condition, and especially if there's pain associated with it, you're worried, is this going to get worse? Is this going to get better? Am I going to have to live with this for the rest of my life? How is it going to impact me? Then secondly is there's no current cure for any of the peripheral neuropathies out there. So what we're doing right now is symptom management. And what we learned from the survey, and again, what we find to be true at the Foundation for Peripheral Neuropathy, is that there's not just one treatment that's going to work for everyone. There's no one size fits all. Rather, it's multiple, a combination of various treatments that will work, hopefully, to help manage those symptoms. And lastly, we learned that patients don't just seek consult from one physician. They often have to go see more than one, maybe 3 or more. And that's just the frustrating part of this condition. It's a very difficult and complicated disorder, and sometimes it takes a little bit of time to diagnose and then treat the symptoms.
Thank you, Lindsay. And as a follow-up, and you may have touched on this a little bit, but what are the biggest challenges reported by patients in the survey?
Well, those with especially the chronic pain from their diabetic neuropathy, they have heightened anxiety and depression levels, which is not surprising due to the frustrating answers or non-answers that they might be getting. The impact on their daily life is significant. Dr. Rodica already referenced driving, but walking, traveling, kind of those day-to-day activities that some of us take for granted are very difficult for patients that live with neuropathy, especially those that live with pain. And then lastly, the survey highlighted the importance of exercise, and that's something that the Foundation for Peripheral Neuropathy really stresses as well. Just minor lifestyle modifications can be a huge impact on your neuropathy and the symptoms associated with it. It sounds a little counterintuitive. If you have chronic pain, you might not feel well enough to exercise or have the motivation to exercise, but really any type of movement is really important, and you can, start low impact, try to increase it if you can, but exercise is really something that should not be overlooked.
Yes, absolutely. And Dr. Pop-Busui, back over to you. What would you like to tell patients who have diabetes and are experiencing this nerve pain?
Well, yes. So I like to mention that although it's absolutely true that we do not have a medication that will reverse the nerve damage that it's already fully established, in fact, we do have ways of preventing this nerve damage to occur. And that's why we encourage patients to try to keep their blood sugars as controlled as possible. Lose weight. Obesity, it's another very important risk factor that can further accelerate nerve damage as well as pain. Keep their blood pressure well controlled and their lipids, and most importantly, engage in healthier lifestyle and healthier diet, and particularly, as Lindsay mentioned, exercise. And we do have evidence that exercise, in fact, it is effective to even reverse perhaps nerve damage, and particularly also help with this nerve pain. Thus, knowing that you can be empowered to participate to your own health, it's very, very important. It's also very important to talk to your providers, because each patient is unique and each may require a very specialized treatment plan. And if medications are needed, and in many instances they may be, we do have agents that have been shown to be effective for neuropathic pain. But what I also like to highlight is that definitely among those agents shouldn't be opioids. Opioids are not recommended because their harms by far outweighs any minor benefits. And that's talking to your provider and making sure that everybody receives the best treatment for that particular case is key.
Great, thank you. And doctor, where can people go for more information?
There is a lot of information out there, as we all know, and that's why it's very important to make sure that we inform ourselves from evidence-based websites. And the Foundation for Peripheral Neuropathy, it's one. It is patient-driven, as Lindsay mentioned, and also has this information in a very patient-friendly way. And similarly, for those with diabetes, the American Diabetes Association, that has been at the forefront of always promoting evidence-based information. There are other websites as well, such as Nerve Pain and Me, but most importantly, if you read information, always discuss it with your providers, your primary care physician, your endocrinologist, because they will be able to, filter some of this information and make sure it's applicable to each individual case.
Yes, absolutely. That's great advice. Thank you. Thank you, Dr. Pop-Busui, for your time, and Lindsay as well. This was great, really great information.
Thank you so much for having us.
Thank you.
Thanks for watching this episode of What's Now. For more great content, stay tuned. I'm your host, Christine Napier. I'll see you next time.